Hello, and welcome back to the channel. Today we're having a discussion. It's something that's on the lips of many people right now, but we're taking it from the public health sphere. Today we're talking about public health and social media. It will be a two-part. So this first portion, directly public health and social media. The second one, I want you to stay tuned for as well. So without any hesitation, I want to start by thanking you for your comments and your questions, and I want you to continue leaving those comments. Like, share, and subscribe if you haven't. So let's get the journey started. It's a beautiful day. We're going to take a walk and we're going to have this discussion. How do you feel about social media? How do you feel about public health? Let's have the conversation. Thank you for being here. What if the environment harming your children is in their phone? Yes, what if the environment harming your children is actually in their phone? For decades, the public health system has warned the public about dangerous environments that lead and paint a picture for these children. Secondhand smoke, unsafe water, air pollution, products placed into everyday life before their long-term consequences were fully understood. But what happens when the environment shaping children is no longer only physical? What happens when one of the most influential spaces in modern adolescence is portable, personalized, algorithmically responsive, and present in the hands of millions of everyday children? Social media has been framed primarily as entertainment, connection, creativity, community, and in many cases, it has been all of these things. But alongside those benefits, a growing body of public health concern, internal platform scrutiny, and legal action has caused many people to have varying opinions. And mental health research has raised a question that now demands far more honesty than it once received. What is this doing to children and teenagers? Not just culturally, not just socially, but developmentally, emotionally, and psychologically. At scale, this question became even harder to dismiss after years of lawsuits, internal disclosures, public hearings, and mounting evidence suggesting that some of the most widely used digital platforms may not simply reflect adolescent crisis, but in some cases may intensify it. So today, we are not doing outrage. We are doing something more serious. The public health question: if youth mental health concerns around social media were serious enough to be studied, litigated, and publicly warned about, why were stronger prevention guardrails not built into the environments children were using every day? That is the question. And perhaps even more importantly, can public health still help reshape what social media becomes next? That is a very important topic to discuss. Because if a system can learn what keeps a teenager watching, surely it can also recognize what may be harming them. One of the most misleading ways this issue is discussed is through the phrase, "Kids are just on their phones too much." No, we have to have a screen time conversation, and this is what we're doing today. The framing of saying kids are just on their phone is too shallow. This is not about time, it is about exposure. Adolescents are in active stages of identity formation, emotional regulation, impulse control, reward sensitivity, sleep vulnerability, social learning, self-worth development, and neurological maturation. Repeated exposure to a digital environment can influence what emotions are amplified, what content becomes normalized, what insecurities are reinforced. Developmental exposure is exactly where public health belongs. This is not an argument that all social media is harmful, but it is equally careless to ignore public health voices. This is what we understand. This is what we're trying to get everyone else to understand. 2023, in 2023, the U.S. Surgeon General Advisory noted that social media safety for children is not fully established, and there are ample indicators of potential harm. This has been brought to the table multiple times since 2023. Up to 95% of youth between the ages of 13 and 17 report using a social media platform. Roughly 1/3 use it almost constantly on a daily basis. The risks highlighted are sleep deprivation, social comparison, and the social comparison aspect of it is very important when we look at even their mental health and how they view themselves. Body image dissatisfaction, anxiety, depressive symptoms, and exposure to harmful content. Public health risk depends on exposure, prevalence, and preventability, not individual antidotes. Isn't it a beautiful day? It is wonderful to be in the park. Now, recent litigation has intensified scrutiny on whether major platforms did enough to protect youth users. Courts have found evidence of negligence or failure to warn in high-profile cases. This is no longer just a parental complaint. It is publicly examining the design and safety use. The verdicts mark a cultural and legal shift. Concern is no longer fringe, but legitimate. Platforms are adaptive environments. They learn from watch time, likes, comments, browsing behavior. Vulnerable emotional states can become algorithmically reinforced. Harm is often cumulative, repeated comparison, distress, and late-night engagement. Public health understands risk as repeated exposure over time, not just single events. And so this is why public health is looking into it, because it's the long-term effects, not the short-term results that matter. Now, let's transition, and we're going to take a look at the evidence-backed based on harm pathways. First thing we could say is sleep deprivation. That is a major concern because we know children need at least 8 hours of sleep. But once they're actively involved with their tablets, their phones, it inhibits sleep. Sleep deprivation is number one. This affects emotional regulation, memory learning, and mood. 2, social comparison and body image. Curated content can increase self-criticism, dissatisfaction, and distorted norms. 3. Compulsive use patterns. Compulsive checking tied to validation or emotional relief. 4. Exposure to harmful content. Self-harm, eating disorders, harassment, humiliation cycles, these all fall under that. 5. Chronic emotional overload. Constant updates and stimulation create low-grade anxiety, attention issues, and emotional fatigue. And this is research supported. Now, parents matter, but public health has never solved large-scale exposure problems by leaving the burden to individuals or parents. Roadworks, water, air, public health interventions occur for these upstream. Digital environments shaping youth should be treated the same way, where the precaution comes with the usage. The guidance, the safety comes with the usage. A serious public health response includes youth-specific design standards, harm interruption, and distress pathway prevention. There should be sleep protective defaults, and we know this would make at least one issue, the issue of rest and the ability to learn, easily treated. But there is no one easy fix that fixes everything. There should also be safer content recommendation pathways, transparent youth safety evidence, collaboration with pediatric and adolescent mental health experts. If platforms influence childhood, then protection should be baseline, not optional. The key warning here is we build one of the most psychologically influential environments in modern history before building public health guardrails to watch and to match it. Public health asks, is the vision serious, widespread, and preventable? So what public health asks when it comes to social media, is the risk serious? Is it widespread? Is it preventable? Because we can give an outlook of what we think it is and what it will be. By that standard, warning signs are already there. So when we look at the seriousness of it and should something be done to prevent misuse or harm to children, by that standard, warning signs are there. The final question then becomes, if a system can predict what keeps a child watching, can it also prevent what may harm them? If not, this is not a tech issue, it's a public health failure. So we're going to strike a balance. And by striking a balance, this question is important. And I'm going to ask the question again because I don't want it to slip by you. I want you to understand that although we blame social media for a lot of the trends and the things that are wrong with children, teens, whoever uses it, and find that there is harm to them, we want to create a balance because healthcare has to take some responsibility. Our government entity, our health system has to come in line with social media, provide not just guidelines, but show them the implications of health and a public health perspective that matters. So I'm going to say this again because it's important to not just lay the blame at the feet of social media and industry techs, because our health system understands the risk. Our health system knows what is conducive for children, for adults, for those with mental health challenges. Our system knows. So let me go back and let me repeat the final question. If a system can predict what keeps a child watching, can it also prevent what may harm them? If not, this is not a tech issue. It is a public health failure. So I stand here today saying that yes, social media may have created some harm and they have a responsibility. But do we really think social media should stand on its own? Shouldn't our healthcare system take some responsibility? Because they advise us about smoking, they advise us about preventative care. Shouldn't there be some advising and some responsibility taken by the healthcare system? Leave your comments in the comments section. I'm ready to have this discussion. Let's take it seriously because it is impacting and affecting us on a wide scale. Thank you so much. It's a beautiful day. The path taken to healthcare is not an easy one, but it is one that we can navigate together and advocate together. Let's do so respectfully. I look forward to your comments. As always, your ability to advocate and perspective has grown with each video. Let's take it seriously. Isn't it a beautiful day? I'll see you in the next video.